ask you, do you think it is normal or acceptable for an adult to strain, be cranky, and/or go red in the face when doing a poo? No? So why is it that parents are so often told that those behaviours are perfectly normal for a baby? Today, it's all about the dirty, smelly, and sometimes explosive end of the digestive system, and ultimately what can be done for a constipated infant. Now, before we explore the ins and outs of the infant bowel system, it is clearly necessary to clarify the definition of constipation. Constipation is defined by the amount of effort involved in a bowel movement, not the frequency or consistency of a poo. In other words, a soft poo done every day requiring 2 to 3 hours of irritability, discomfort and strain is constipation. Whereas that solid nugget done every few days with little or no effort is not technically constipation. Now, a regular question I have in practice is clarification on how often should a breastfed versus formula-fed baby have a bowel movement. Many parents are often told that it is not unusual for a breastfed infant to go somewhere between 7 and 10 days between bowel movements. Now, there is some truth to that statement, with a great big but. Yes, it's not unusual for breastfed babies to go longer between poos, but again, it all comes back to the strain, amount of effort, and any behavioural changes involved in doing that poo. So now that we know what constipation really is, do we still think it is normal for an infant on a liquid diet, whether that be breast milk or formula, to strain, be uncomfortable, and/or to have a poo face? If your answer is no, then let's explore some options. One of the first recommendations made to many parents is to increase your child's water intake. Now, this is interesting for two major reasons. One, an infant's diet under the age of 6 months is typically exclusively liquid based. So are they really suffering from a lack of fluid in their diets? And two, when we drink fluids such as water, do we often pee or poo more often? Many parents are also encouraged to massage their baby's abdomen and/or to move their little legs in a cycling motion to help alleviate some discomfort. A less common and slightly more challenging recommendation is for many parents to reduce the child's dairy intake. This may require a shift to goat's milk formula or for a breastfeeding mum to cut dairy from her diet. The reason for this is that much like the irritable and unsettled child, the cow's milk protein is contributing to digestive issues, in this case at the bottom end of the digestive system. Finally, an option I would encourage you to explore is chiropractic care from a chiropractor who has undergone extra study in the kids arena. Chiropractic is based on the principle that the spine and nerve system are intricately related, and any dysfunction in this relationship may and often does result in problems. In the end, to poo is a natural, normal process. It should never be uncomfortable, require straining, or be upsetting for either infants or adults. So to find out more, if you have any questions, please go to mhcc.com.au and please share this video with family, friends, loved ones, and even those mothers groups.